Good afternoon, everybody. Thank you for joining in. I would like to welcome Clay Bryant back. We're excited to hear the presentation on communicating HI data. Uh, Clay, let me stop sharing my screen and you can take over.
Awesome. Thank you so much. Okay, so everyone should be able to see my screen now. So, good morning, everyone, and thank you for joining us today for the Norton Infectious Disease Institute Grand Rounds. My name is Clay Bryant, and I am the NHSN Program Lead for the Kentucky Department for Public Health's HAI-AR Prevention Program. So, as we know, data plays a pivotal role in communication, and it really serves as a crucial input for decision making and acts as a tool to assess performance. Nevertheless, numerous individuals and facilities encounter challenges in harnessing the potential of data and conveying it effectively to drive and motivate action. With this in mind, it is a real pleasure to be able to be here today to discuss how we can use hospital-acquired infection data available within NHSN to tell our hospital story and communicate these data in a meaningful way that will allow for our audience to gain insights and make data-driven decisions. By the end of this presentation, you should be able to explain the three key components of data storytelling, as well as be able to identify and describe the various event level and summary level data available within NHSN. Keep in mind, we will not be able to discuss every report option available within NHSN. If you have questions regarding a particular NHSN report option, or you would like just simple consultation on data available for your facility, please do not hesitate to contact me. My contact information will be listed at the conclusion of this presentation. Let's begin by exploring the concept of data storytelling. In essence, data storytelling is the art of effectively communicating insights derived from various data sets through the use of narratives and visualizations. Data storytelling encompasses effective communication. It's about conveying complex information in a way that is easy to understand and engaging. It's not just about presenting numbers, it's about making those numbers meaningful. Data storytelling is a powerful tool for influencing informed decision making. It goes beyond the data analysis. It's about using data to drive action and change. Data storytelling is really the union of analysis and communication. It combines the analytical aspect of data analysis with the communicative skills of storytelling. It ensures that data-driven insights are not only comprehensible, but also actionable. Now, why does data storytelling really even matter? Data can often be overwhelming or really seem abstract. It's easy for people to become disengaged when presenting with raw data. However, when you tell a story with data, you make it relatable and relevant. For example, your facility has observed an uptick in CLABSI and you have been asked to present to senior leadership. You use the SIR or SIR to communicate the problem. However, the SIR is really telling us what we already know. We observed more infections than we were predicted to have. What additional data can you use to complement the SIR that gives insights into what is contributing to the excess number of infections that you have observed? Well, through narratives and visualizations, you can take your audience on a journey. You can help them understand the context, the implications, and the action that is required based on the data. It's about turning your data into insights and insights into action. Now let's break down the three essential components of data storytelling, which are fundamental to crafting a compelling narrative around your healthcare associated infection data. Starting with your data. Data is really the foundation for your data narrative. To create an impactful story, you must start with a comprehensive and precise set of data. This involves conducting a thorough examination of the data, ensuring its accuracy, and understanding the nuances that it contains. In the context of HAI data within NHSN, this data could include infection frequencies or counts, rates, ratios. Without robust data, your storytelling efforts lack substance and credibility. Second, visualizations are your visual aids that bring your data to life. These can take the form of charts, graphs, tables, or other types of visual depictions. Visualizations are a powerful tool because they simplify complex information, making it easier for your audience to grasp. In the context of HAI data, you might use graphs to show trends and infection rates over time, or tables to compare data between different locations within your facility. Effective visualizations enhance understanding and retention, as well as reinforce the message that you want to convey. Now let's discuss some of the benefits of data storytelling. One of the primary benefits of data storytelling is the ability to bring clarity and comprehension to complex sets of data. It allows us to translate intricate data into a meaningful insight that people can easily grasp, even if they aren't data experts. This is especially important in healthcare, where precise understanding is critical for informed decision making. Second, data storytelling frames data with a narrative structure. It sparks interest and fosters engagement, encouraging your stakeholders to pay attention and absorb the information. Data storytelling equips you with the tools to communicate these insights effectively. By presenting data in a narrative format, you can facilitate better decision making within your facility. It's not just about presenting numbers. Again, it's about making sure that those numbers drive action. Data storytelling helps align your different stakeholders around a common understanding of the data and its implications. In the complex healthcare environment, where various teams and departments are collaborating, this alignment is crucial. It ensures that everyone interprets the data in the same way, reducing the chances for miscommunication and misunderstanding, as well as it provides context, which is another key advantage. Data storytelling provides context to the data by helping the audience understand not just what the data shows, but why it is important. In the case of HAI data, this might mean by explaining how the SIR is a summary measure and that it can be used to track HAIs not only at the facility level, but nationally over time. Providing context adds depth and relevance to the data. Lastly, data storytelling empowers individuals and teams to make data-driven decisions independently. It reduces the reliance on data experts and promotes a data-driven culture within your facility. As mentioned, data is the foundation for your narrative. We will start with highlighting some event and summary level data available within NHSN. Please keep in mind again that this presentation will not cover all data available within NHSN, rather highlight some of the data that can be used to craft your narrative. Now let's start by discussing how we can build a compelling story with the wealth of data that is available within NHSN. To effectively communicate the impact of HAIs, we need to consider the various data sources and angles. Here we're able to give an explanation of a few. Starting with examining location-specific SIRS or standardized infection rates or ratios, this data will provide insights into which areas within your healthcare facility are most affected by HAIs. It's essential for identifying hotspots and targeting interventions. For example, with surgical site infections, we could consider drilling down to procedure and surgeon level specific SIRS. This level of detail can shed light on specific practices or individuals that may require further attention and improvement. Digging deeper into event and pathogen level information This data can help you understand not only the types of infections, but also the pathogens that are responsible. This knowledge can inform prevention strategies. Analyzing quarterly or yearly SIRS to identify trends and patterns over time, such as using infection rates. Are they increasing or decreasing? Understanding a temporal trend is crucial for making informed decision making and setting a realistic goal. We could also consider location-specific standardized utilization ratios, or SIRS, and device utilization ratios, or rates. These metrics can reveal how medical devices are being used in different areas of your facility and whether or not there's a correlation with HAI rates. This is an essential aspect of prevention. Lastly, we could utilize the TAP strategy or TAP reports. These reports provide tailored insights and recommendations for HAI prevention. They can help you focus your efforts and resources where they are most needed. By harnessing the diverse data that is available within NHSN, you can really craft a comprehensive narrative that goes beyond surface level data. This multifaceted approach allows you to tell a story that not only highlights the challenges, but also the opportunities for improvement in preventing HAIs within your facility. Each data source mentioned contributes a more complete and impactful story. Let's dive into some of the specific types of data available within NHSN, starting with event level data. Think of event level data within NHSN as a detailed or granular form of data collection that provides information about specific healthcare associated infections and their associated events. This level of data is critical for an in-depth analysis and surveillance of infections within a healthcare setting. Event level data is essential for providing a more comprehensive understanding regarding these events that are contributing to our summary level data, such as the SIR. The first thing that we will start is looking at event level data. So we'll start with line lists. Line lists are a great report that can be used to provide information on specific events observed within a facility. These reports can be customized to include data elements of interest. In this particular example, we're looking at surgical site infections. In this line list, I have included variables of interest such as the ASA score, if the patient had diabetes, if the procedure was considered an emergent procedure, the wound class, where the SSI was identified or detected, and lastly, the time from procedure to event. Additional data elements that could be included are if the SSI was associated with a secondary bloodstream infection. Did the patient have COVID-19? And the particular pathogen that was identified. Line lists can be exported to Excel for further analysis. In the example on the screen, I have exported this line list and have used a pivot table to summarize the average number of procedure to event days for each SSI procedure, as well as the specific event type. Another example is I have used a pivot table to summarize the count of events by SSI type and where the SSI was detected. For example, 10 colo SSIs were detected during admission, or denoted by A. Line lists can be generated for each HAI type, not just surgical site infections, but also CLABSI and CAUTI. For example, a line list for CLABSI could be used to see the events that were included within the SIR, or could be used to see the events that were excluded from the SIR and why they were excluded. Or say we wanted to look at the percentage of CLABSIs that had a dialysis line in place. When it comes to analyzing event level data within NHSN for identified pathogens, there are several approaches that you can consider to gain valuable insights. One effective way to examine data is by creating a frequency table. This table displays the count of specific pathogens associated with each type of healthcare-associated infection. For example, you can easily see how many cases of a particular pathogen were linked to a surgical site infection, urinary tract infection, or another type of HAI. This approach provides a clear and concise summary of pathogen distribution across different infection types. Another option is to use a line list that includes pathogens 1 through 3, as well as the descriptions as their variable. This line list allows you to list individual infection events that provides a detailed description of the pathogens involved. It offers a more comprehensive review of each case, including the specific pathogens that are responsible for the infection. To gain deeper insights, consider running frequency tables of pathogens by different dimensions. You can break down the data by location type, such as the ICU or ward locations. You can consider by doing those that were considered multi-drug resistant organisms, or by a specified time period, such as monthly or quarterly. This approach helps you identify trends and patterns identify trends and patterns and specific pathogen prevalence within the specific contexts. For instance, you could assess which location or units have a higher incidence of MDRO-related infections or how pathogen frequencies have changed over time. Again, when dealing with event-level data in NHSN for healthcare-associated infections that involve antimicrobial resistance, it is crucial to apply a focused approach for these analyses. Consider creating a line list that compiles all device-associated infection and surgical site infection events reported with an that are associated with a particular antimicrobial resistance phenotype. This line list allows you to gather detailed information about each individual infection event that meets the criteria for the selected antimicrobial resistance phenotype. To facilitate this type of analysis, you could refer to the phenotype definitions provided by CDC. These definitions are designed to guide healthcare facilities in identifying specific antimicrobial resistance phenotypes. You can assess the phenotype definition document by using the URL on your screen. By applying these phenotype definitions and creating a line list accordingly, you can isolate and analyze events that involve antimicrobial resistance. This focused approach allows you to gain insights into the prevalence and the impact of specific antimicrobial resistance phenotypes within your healthcare facility. In our efforts to extract meaningful insights from event-level data, especially when dealing with lab ID events, we could consider utilizing frequency tables that can be an invaluable analytical tool. Frequency tables are a simple yet powerful way that we can summarize data. They provide a visual summary of how data is distributed across different categories. In this case, we're looking at MRSA Lab ID events, and we'll use a frequency table to organize this data effectively. In our example, we've set up our frequency table with the rows representing the different location types within a healthcare facility. These could be various units or areas where patients receive care. On the other hand, the columns are dedicated to the onset of MRSA or MRSA Lab ID events. We're interested in understanding when these events occurred. What can we discover? Well, by examining this frequency table, you can make several observations. We can quickly identify which location types have the highest and lowest frequency of MRSA Lab ID events. This information is essential for targeting infection control efforts. With this information, healthcare facilities can prioritize interventions in high-risk locations. Facility tables are not just about the numbers, they're about enabling data-driven decision-making by structuring our data in a way that we can gain insights that can inform our strategies for infection prevention. Now we will transition into summary level data. Summary level data within NHSN refers to aggregate or higher level data that provides a broad overview of HAI trends. Unlike event level data, which captures detailed information about individual infection events, summary level data presents a consolidated view of HAI data for a specific facility, location, or time period. There are various summary level data that are available within NHSN. In today's presentation, we will mainly focus on the SIR, device utilization rates, CAD, and infection rates. Understanding and utilizing the SIR is vital for tracking HAIs at various levels, such as the national, state, and local level over time. The SIR is a powerful tool that can that can be used to measure and monitor and compare HAIs across different healthcare settings. It condenses complex infection data into a single, easy to use and understand metric. The SIR is not just a raw number, it's a comparison. It compares the actual number of observed infections within a healthcare facility to what we would expect based on the national standard. And in this case, the standard is the NHSN 2015 baseline, where the SIR is set at 1. The SIR serves as a benchmark that tells us if a healthcare facility's infection rates are higher or lower than expected. One key feature of the SIR is it is risk adjusted. It takes into account various factors that can affect infection rates. This ensures that the comparisons are fair. The SIR should be your go-to metric when we need to aggregate data from multiple sources, such as using different locations within a healthcare facility, or various procedures, or even data from multiple hospitals. It provides a standardized way to compare infection rates across diverse settings. The SIR is a vital tool for infection prevention and control efforts as it helps healthcare facilities identify areas where their infection rates may be higher than expected, which enables them to focus resources and interventions where they are needed most. And a quick did you know, within NHSN, did you know that you can actually compare two SIRs within NHSN, specifically using the statistics calculator? In this example, we use the compare to standardized ratios. In this example, we can see that the ratios between 2021 and 2022 for CODI at KDPH Hospital are 16.2% different. However, we can use a statistical analysis to be able to determine whether or not this difference is statistically significant. And based off of that two-tailed p-value of 0.67, based on an alpha or a p-value of 0.05, we can determine that this difference is not truly statistically different. And this tool can be found under the Analysis tab on the left-hand side of NHSN, where we would go to pull reports as well as generate our data sets. Next, we'll talk about the CAD. The CAD is a metric that helps us assess the importance of our infection prevention efforts. It provides insight into differences between the number of observed infections and what would have been predicted based on certain baseline or expected rates. To calculate the CAD, we can compare the actual number of infections or observed infections to the number that we would expect to see based on a reference or predicted value. The SIR goal can also be added as a multiplier to the CAD calculation. This helps us determine the number of excess infections or infections that would need to be reduced to meet our specific SIR goal. This is a way to quantify the impact of our infection prevention efforts in relation to the goal that we have set. When it comes to tracking HAI incidents on a monthly basis, the metric of choice would be rates. Unlike some situations where facilities may not have a predicted number of infections greater than one, rates can provide a useful way to express the frequency or occurrence of infections within a specific time frame. Rates, in the context of summary level data, are a standardized way to express how often events, such as HAIs, occur relative to the specified unit of measurement and time period. It is important to note that rates should not be used to compare different healthcare facilities or specific locations within a facility. Unlike other metrics, such as the SIR, rates are not risk adjusted. This means that they do not take into account the variations in patient population or other factors that can influence infection rates. Again, did you know that you can look at the statistical significance of the difference between two rates? For example, if we wanted to compare the 2022 quarter one and 2022 quarter four CLABSI rate at KDPH Hospital to determine if they were significantly different, we could do so using the statistical calculator. Now, when we are doing this, we can see that they are statistically different based off of that p-value of being less than 0.05. But we want to be careful to not misinterpret this as we are only looking at two particular periods of time. So we could not conclude that the CLABSI rate has significantly decreased over time. We can only say that there is an observed difference between quarter one and quarter two. And the last bit of summary level data we'll talk about is the device utilization rate. This is a metric or device utilization ratio. This is a metric that helps us understand the extent of device use on a given healthcare unit in relation to the number of patient days. The DUR is a simple yet informative metric that is used to help quantify the utilization of medical devices within a healthcare unit. It provides a measure of device use relative to the number of patient days. By tracking the DUR and understanding how it correlates to infection rates, healthcare facilities can identify opportunities for quality improvement, as well as reducing the device utilization ratio may be a goal to minimize the risk of device-related infections. Now that we have covered the various data elements available within NHSN, we will discuss how to structure our narrative using data storytelling. Structuring your narrative using NHSN data is not just about presenting numbers, it's about telling a compelling story that drives action and improvement. Let's break down the key elements of a well-structured narrative using the data storytelling arc. Beginning your narrative with a captivating hook. This could be by a surprising statistic or a real-life patient story or a pressing question. The goal is to grab your audience's attention and make them curious about what is to come. For example, did you know that the estimated additional cost of each CLABSI is $48,108? And more importantly, these events are preventable. As you proceed building the narrative by presenting the rising insights, these are the facts, data, and trends that gradually paint a picture of the problem or situation that you're addressing. Use visual aids like charts and graphs to illustrate these insights clearly. For example, using the various event level and summary level data elements to craft your story. This is the turning point in your narrative. The aha moment, when you connect the dots and reveal the root cause or significance of the problem. It's where you make your audience understand why they should care. For example, we have discovered by conducting a root cause analysis for each CLABSI event, a significant portion of these infections can be attributed to lapses in proper central line maintenance, most notably CHG bathing. Lastly, we can transition to the solution or next steps. What actions can be taken to address the problem or seize the opportunity? We want to be specific about the interventions or changes that are needed to emphasize the positive impact that they can have. For example, there is a gap identified in CHG bathing. To address this issue, we are implementing a best practice advisory that would show in the EHR when a patient has a central line, as well as we will develop an escalation plan when a patient refuses CHG bathing. By structuring your narrative in this way, you can engage your audience by data-driven decision making and inspire them towards positive change. Lastly, we'll quickly discuss some considerations for creating visuals. So when creating visuals, we want to take the following into consideration. We want to determine that the appropriate visualization is being used. Before creating any visuals, we want to consider the nature of your data and the message that you really want to convey. Also, we want to create visuals that convey your intended message. Visualization should be more than just good-looking graphics. They should include data that is used for communication, to communicate what we are wanting to see. And lastly, they should focus the attention on the audience. Visualization should be used as a tool to guide your audience's attention towards important insights. For example, if we're discussing the infection rates over time, we could use a line chart that clearly shows a downward trend and consider adding annotations or call outs to highlight specific milestones or interventions that contributed to these improvements. And that is all that I have for today. I appreciate each of you for attending today's session. And if you have any questions or would like consultation regarding NHSN data or how to develop a compelling story or narrative using your NHSN data, feel free to give me a call or email at one of the email addresses listed on the screen. Thank you.
All right. Well, thank you so much, Clay. And next week, we're going to have our nurse practitioner, Kirsten Trudeau, talking about outbreak identification. And we will see you next week.